My name is Rebecca Fielding Miller, and I am a social epidemiologist, which means I study how the way that we spend our time together and the way that our societies are set up affect who has the ability to keep themselves healthy and who might struggle a little bit. So before COVID-19 happened, I spent a lot of my time thinking about things like HIV in Southern Africa and in the United States. And now, just like all of us, I'm spending a lot of my time thinking about COVID-19. So today I want to share a little bit with you about not just the biology behind COVID-19, but the social epidemiology. So who is getting sick with COVID-19 and why? And I want to talk a little bit about how our principles as Unitarians are really deeply intertwined with the correct public health evidence on how we can keep ourselves safe and keep our society safe. So COVID-19, I'm sure we all know, began in somewhere between November and January in China, and it rapidly spread throughout the world. This is the number of cases per million people as of February 1st, 2020. This is March 1st, April 1st, May 1st, and this is as of last week, June 19th, 2020. And you can see that recently the epicenter of the COVID-19 pandemic is very much in the United States. For a number of weeks, New York City was the epicenter of the outbreak, and now it's beginning to move throughout rural areas. But you can see there's no part in the world that isn't really affected except for New Zealand, which has done a tremendous job. But it's really in America that we're being the hardest hit. So this is what COVID-19 looks like in the US. These shades are in order of magnitude. So each time the red is a little bit darker, that means 10 times more people have died. And you can see that New York, Los Angeles, Seattle, Chicago, these big cities, Denver, these are the places where people have been dying the most. These are the areas that have been the most affected. But you can also see this interesting phenomenon where, for example, if you look over here at the Four Corners area, this is the Navajo Nation. And the Navajo Nation has extremely high case rates and an extremely high number of people who have passed away of COVID-19. You can also see some bright dots out in areas you wouldn't expect, and those tend to be things like meatpacking facilities or a funeral, actually, is what happened here in southwest Georgia. So the big cities are the epicenters, but there are some social factors that are putting people at risk in other places. You can see Detroit has quite a big outbreak right here, and that has a lot to do with inequality and poverty. So I know in another video you guys have learned a little bit about some of the ways that COVID-19 is spread. It's spread through things like coughing or sneezing, where respiratory droplets get in the air and then somebody else breathes them in. It's spread if you touch a surface that somebody else has coughed or sneezed on or touched, if they had respiratory droplets on their hands, and then you put your hands in your mouth and your nose. And I know Christina Boardman did a really nice job explaining that. And so some of the best ways that we can protect ourselves from getting sick are by washing our hands a lot, staying at least 6 feet away from other people, being outside if we are going to be around other people who we don't live with, wearing a mask to protect other people from our respiratory droplets, and staying home if we don't feel well, because that will keep us from infecting other people. But the problem is, not everybody has the ability to do all these things. So this is a list that is making the rounds of the internet. I don't know that I agree with all of this, but I think it's a pretty reasonable starting place. And this is just one way to think about what things can we do, what is the risk level of different activities that we want to do every day. So for example, getting takeout at a restaurant where you order it in advance or over the phone, you go inside wearing your mask, you pick up the bag, and you bring it back home again, probably pretty safe. Camping, where you go, you're outside, you set up your own tent, especially if you're not sharing a bathroom with a lot of other people who are out camping, probably reasonable. Going for a walk or a bike ride with other people, especially if you stay 6 feet away, pretty reasonable. Going to a bar is not a great idea because they're crowded, people talk really loud, and when we drink, we tend to get a little bit forgetful.
and sloppy. That's how we can keep ourselves safe. Similarly, gyms are enclosed spaces where a lot of people are breathing heavily and not wearing masks, so they're not very safe places to go. But there's another way we can think about this. These are risk factors for you as an individual, but there are other people involved in each of these, not just you getting your takeout or going to the gym. So, for example, when you get takeout or when you go to a restaurant, there's the people who are making your food and serving your food. When you decide that you're going to be really careful and you're going to take Lyft or a taxi, there's the person who's driving you. There are the home health aides and the people who work in healthcare settings who are helping folks, who are providing support to doctors and nurses. And there's the custodial staff who are keeping things clean in hospitals and hotels, in office settings, everywhere that we go. And these people have very different risk factors. So the people in a kitchen are at much higher risk of getting COVID-19 than you when you walk in to get your delicious takeout. While the individual risk to you might be pretty low if you take Lyft once, the driver is coming into contact with lots and lots of people in an enclosed space every day. Similarly, your risk of taking an airplane might be individually medium, but for the flight attendants who are coming into contact with lots and lots of passengers every day, their risk is probably pretty high. And so I think we can't just think about individual risk, we have to think about the risk of an activity to everybody. And what's really important to think about is a lot of these jobs that are high risk are also jobs that are really low pay. So I really like this graph because it looks at this x-axis here down at the bottom is kind of a guess at how risky these different jobs are. And the y-axis is how much those jobs get paid. So you can see down in the bottom right, there are jobs that are low pay and high risk, and that's things like nursing assistants and orderlies and paramedics and home health aides, childcare workers, bus drivers, flight attendants. And you can see in the top left, those are jobs that are low risk and high pay. So if you're a CEO who can work from home, or you're a lawyer who can work from home, you're a fancy professor who can work from home, these are all high pay and low risk. And I think it's really important that we notice that a lot of these essential worker jobs are very low paying jobs. So people who work in grocery stores or in pharmacies, people who are cashiers, people who are wait staff. And the vast majority of these jobs, people who work at these jobs are people of color, and especially women of color. And so what that does is that means that the people who are at the highest risk of getting sick are also women of color and people of color. So this is data from New York, where we can see that people who are Hispanic or Latino or African American have significantly higher rates of mortality than people who are white or Asian. And this is data from Northern California, where we're seeing the same, that in San Francisco County, Latinos, Black folks are at significantly higher risk of both contracting COVID-19 and of dying. And that's not a coincidence, right? So this is our map again. So think again about where we're seeing people getting sick. And we can see that this pattern of what we call health disparities, racial health disparities, is happening across the United States. Pretty much everywhere in the US, there's a disproportionate amount of African Americans, minorities, people who are living in poverty, are disproportionately getting sick and are disproportionately dying. And I would say that in Arizona, there on the left, the only reason that that little box is kind of bluish gray for Arizona is because the health disparities are largely in the Navajo Nation, as opposed to among African Americans, which is where this graph is measuring in particular. So what does that mean for us as Unitarians? I think that all of these principles that we think about are really related to public health. In particular, I think a lot about the seventh principle, how we are all deeply connected in an interdependent web. We are all connected to one another. You are connected to the person in the kitchen who is making your meal when you just can't handle making dinner one more time and you want takeout. You are connected to the person who is cleaning the bathroom that you used when you had to get gas, had to make a pit stop, ran in, and you were very careful and you think it was low risk to you. Somebody is still cleaning that later. And I think it's also incredibly important that we think about the 8th principle that a lot of people are advocating that we all add to our communities, that it is our job to be aware of and accountable to systemic racism in our system. And to me, what that means in particular, as somebody who is white, and I know many members, although not all members of our community are white, it's important for those of us who have those privileges, we have an obligation to think very carefully about how are those privileges helping or harming others. So how is the ability to use Instacart to keep yourself safe? How does that help or harm the Instacart drivers who are making significantly less money than we make and who are more likely to be people of color? How is the ability to use Lyft if we don't feel that it's safe to take a taxi or a bus? How does that ability to protect ourselves put somebody else at risk? We have an obligation to think about these things. And so when we see graphs like this is another version of individual risk of COVID-19. For example, staying in a hotel. Maybe it's a low risk for you, but it's a high risk for a lot of other people. When we think about taking a taxi, maybe it's a low risk for you, but it's a high risk for other people. Getting your hair cut, maybe it is a pretty low risk for you for a one-time encounter once every 6 months where you're facing away and you're wearing a mask. But for somebody who is cutting hair or doing nails every single day, each time there's an encounter, their risk goes up. And so is that something you want to participate in, even if you miss having really nice nail art? I miss having really nice nail art. I know the best place in San Diego. When we have a vaccine, come ask me. The risk of grocery shopping. Maybe it is low for you, but what's the risk for the people who are restocking the shelves, who are working in the warehouses? What's the risk for the people who are working in farms and meatpacking plants to keep those shelves full? It's really high, and we're seeing consistently that people who engage in farm work and crop work are at exceedingly high risk. The risk of takeout has to do with the risk of what's happening in the kitchen, and so it's important that we be responsible and think not only about who can I access easily on Grubhub, but which restaurants in my area are making sure to provide sick leave and have been really thoughtful about making sure that their staff are safe. These are all things that are really important for us to do. Don't go to the gym. Just don't. It's a terrible idea for everybody. I don't care what graph. A lot of people breathing inside is a bad idea. So I think the most important thing that we can think about when we think about COVID-19 and the risk to everybody and this idea of social and health disparities is when you have a pandemic that affects everybody, when you have a pandemic that is airborne, none of us are safe until all of us are safe. We are all connected. So it is our values to think about who is at highest risk and how we have an obligation to build a society that protects everybody, especially people who are the most marginalized. But it's also in our best interest, because until we have a system that works for people at the furthest edges, we don't have a system that works for anybody. So this is a quote that I really like. It's by Lilla Watson, who's an Aboriginal activist. And she says, "If you've come to help me, you're wasting your time. But if you've come because your liberation is bound up with mine, then let us work together." And I think that's the most important thing that we can think about. We are all so deeply connected, and the heart of public health is social justice. So thank you. I really enjoyed getting to talk to you virtually today. If you ever have any questions, you are so welcome to reach out, and I'm so happy to answer.